heard from people across the country regarding a strange illness that's affecting at least a dozen teenage girls in Leroy, New York. Good evening, I'm Mary Ellis Demler.
Hello, everyone. I'm Scott Levitt.
Sarah Hopkins has a story and a portion of an interview with the girl who's affected. That's new tonight.
We just got a preview of the interview that will be airing, and once you see the tics these girls are experiencing, well, they speak for themselves.
I've never been so controlled in my life. I was always so I was always so active, and everybody was always happy to be around me, but I don't feel like myself anymore. I'm not getting the help that I should be.
Okay, so tell us what you can now about the diagnosis for the girls. The diagnosis is conversion disorder. We have tested for everything related to movement disorders. I have gone well above and beyond normal testing for movement disorders. What does it mean? Conversion disorder is a type of a somatoform or somatization disorder whereby psychological or stressful issues or events are manifested in a physical form. So, for example, someone could have tics per se, or they could have a seizure-like episode, or a near fainting spell, or stomach upset, or headaches, things like that.
Also, they could have loss of sight, deafness, or inability to speak. Loss of balance, paralyzed leg or arm, and difficulty to swallow are also possible symptoms.
But would the girls have to have a stressful situation, the same stressful situation? Have a stressful situation at the same time or in the same place? Or I don't understand what the stressful situation would have to be. For every individual, each stressor is different. A teenager in high school, there are several stressful things that occur in their life that can cause you to have great discomfort or upset or anxiety about things. So for each person, it does not have to be the same thing. Why just girl? In history, it's more typical that it happens in females. I understand that. The thing is that when a diagnosis can be accepted, though, and there can be appropriate treatment given, then we can move on and people can get better. And I'm happy to say the majority of people that I'm treating have greatly improved since we started. And the longer people have been with me, the more improvement we have seen. What is the treatment for conversion disorder? In general, can be treated with psychotherapy or psychological assistance, so going to a counselor, going to a psychiatrist, behavioral modification therapy, so if there's a behavior that's occurring that is undesirable, such as a movement that is undesirable, transforming that into something that is more desirable or more appropriate in a social setting, understanding what caused the initial event, deal with stress in a more appropriate way. You can use certain types of antidepressants, and mind you, certain types of antidepressants can cause undesired side effects, so you have to be careful in what you're using. You can use a muscle relaxant if there is, some sort of a spasm in a muscle because someone has been overusing the muscle. So that would be, in general terms, what you could use for conversion disorder. Dr. Mayfield, because some parents just aren't buying conversion disorder. I understand that, and if, as a parent myself, I would have a difficult time understanding that too, and your primary concern is for your child and your child's well-being, and it's hard to hear that they're stressed and there's some stressor that's causing them so much discomfort that they're manifesting symptoms that are physical.